Welcome to the Hospital DisasterNet training for dispatch personnel. This short training will familiarize you with the DisasterNet and walk you through the process of activation during an incident. This module is less than 10 minutes, and it is vital for dispatch personnel to be able to activate the DisasterNet effectively. A mass casualty incident can overwhelm emergency medical services, as well as equipment and personnel. DisasterNet is an essential part of a successful response in the greater Cincinnati region. The ability to quickly share information across the region with healthcare providers is essential in an LMCI incident. The ultimate goal is to save the most lives. In addition to the mass casualty incident, DisasterNet can be utilized for the National Disaster Medical System Operations, NDMS, where patients from a disaster site are transported to the region from other areas involved in a disaster from around the country. DisasterNet can be used for mass casualty or terrorist incidents, hazardous material incidents, even if there are no patients being transported. There are toxic fumes could move towards any hospital, large fires, hospital evacuations, and NDMS response. There are two components to the DisasterNet, the radio and the web-based system. The radio serves as a notification to hospitals, providing information on the situation from the scene. The web-based component is called SurgeNet. Hospitals enter current capabilities for their emergency departments. When activated, the DisasterNet is used to notify hospitals that an incident has occurred and that hospitals are asked to enter their capabilities into the SurgeNet system. The hospital enters the number of each triage level that they can receive, red, yellow, or green. Hospitals cannot accept deceased patients during an incident. This is a screenshot of what the local mass casualty board looks like. When the DisasterNet is activated, each hospital has the ability to update the receiving capability. During the incident, they can update how many patients they have received. Net Control monitors this page to assist responders on the scene to route patients to an appropriate facility. On-scene responders will not have to view this page during an incident. Net Control will assume control once the net is opened. Activation. This is the Hospital Disaster Network process flow chart. We'll now walk you through each piece of the process. Most importantly, the role you as a dispatcher can assist in the process. Responders on the scene, as well as other response agencies, have the ability to activate the DisasterNet. Early notification will give the hospitals additional time to prepare for the arrival of patients from the scene. Requests to open the DisasterNet come into Hamilton County Communications Center either by phone or by radio. Dispatch centers may be the first to recognize an MCI has occurred. Requests for multiple EMS units, the MCI trailer, or an incident in a large venue would likely be appropriate to request the DisasterNet be activated. To suggest to the scene incident commander if the event warrants the DisasterNet should be activated. You can request that this occur without any ramifications, as the hospitals prefer to be prepared versus surprised. This slide shows the information that is needed to pass on to the hospitals so they prepare appropriately for incoming patients. Once DisasterNet is activated, the alert is issued over all radios. Hamilton County Communications Center opens the net, requests all hospitals update capabilities in SurgeNet. Information and updates about the incident will be relayed to all DisasterNet radios in all the emergency departments. A roll call is conducted during the DisasterNet testing only and not during a real-world event. Hamilton County Communications Center will transfer responsibility over to Net Control. Net Control is operated by UC Health's Air Care Mobile Care Dispatch Officer, not University Hospital. Net Control will collaborate with the scene to determine the destination of victims based on SurgeNet data. EMS routing or transportation officer must establish radio or phone contact with Net Control to begin the transport process. Net Control will also update the scene and the hospitals as the incident progresses. Once it is determined where a victim or victims are to be transported, the scene reports the following information to Net Control via DisasterNet: the unit name number, the number of patients, triage level, the hospital destination, and then any specific needs, such as the patients are pediatric, obstetric, or burn. Communicating these special needs will route the patients to the hospitals that can provide this service. By using DisasterNet to coordinate incident operations and transportation, EMS will not need to contact the emergency departments directly. The destination hospital will acknowledge receipt of the information over the radio from Net Control. When DisasterNet is activated, no radio traffic is to occur on the net between EMS and hospitals. As patients are transported, hospitals will continue to update SurgeNet indicating how many patients were received, how many patients they can still accept. Net Control will remind hospitals regularly to update their capability data in SurgeNet. For demobilization, to deactivate the system, once all the patients have been transported, the scene will notify Net Control. Net Control will request to close the net. Hamilton County Communications Center will close the DisasterNet. Net Control will conduct a reconciliation of transport with scene and hospitals. Some hospitals are out of range and do not have a DisasterNet radio. However, these facilities will receive the same communication via telephone, and those hospitals are listed on the slide. You can access this training module or the entire guidance document on our website. Look under DisasterNet Training. Thank you for taking the time to learn about the DisasterNet and how it can efficiently assist in patient movement in the region. Questions can be directed to the Health Collaborative staff, and on-site training is available. Thank you.